সম্মানিত দর্শক ও শ্রোতা, আজ হেলথ চ্যানেলের পক্ষ থেকে ওয়েলকাম। আসসালামু আলাইকুম। আজ অ্যাপেন্ডিসাইটিস সম্পর্কে সংক্ষিপ্ত আকারে বলার চেষ্টা করব। অ্যাপেন্ডিসাইটিস 1886 ফার্স্ট ডক্টর রেগিনাল্ড ফিটস invented, and most common surgical problem in emergency. Appendicitis is the inflammation of appendix that develop most common adolescent and young adult. Inflammation of the appendix and is the most common acute abdominal pain. McBurney's point is the severe pain sensitivity. Appendix in different position: retrocecal, posterior, preiliac, subcecal, pelvic, and different age in highest rate 12 to 15 years age, mainly male, more than the female. Due to obstruction of the appendicular lumen by fecal leaf, foreign body, gallstone, mucocele, any tumor, diffuse lymphoid hyperplasia, vermicularis, and non-obstructive generalized infection, tuberculosis, measles, and Crohn's disease. The signs, symptom: right lower quadrant tenderness, elevated temperature, rebound tenderness, and symptom anorexia, nausea, vomiting, and migration pain to the right lower quadrant, and laboratory value leukocytosis more than 10,000, white blood cell, and neutrophil more than 75%. If scored less than 4, evaluate for other cause. 5 to 6, possible observation. Score 7 to 8, probable appendicitis, and 9 to 10, very probable for surgery. This dull, steady pain around the periumbilical area, 4 to 6 hours, is localized to right lower quadrant, and low-grade fever, nausea, anorexia, and sudden pain relief indicate the rupture of appendix. For appendicitis, we need investigation: total blood count, differential count, C-reactive protein, and urine for culture sensitivity for female for pregnancy test. An imaging study: X-ray abdomen in erect posture, ultrasonogram to rule out any other pathology for women, ultrasonogram to confirm the appendicitis, and CT scan of abdomen. Differential diagnosis: acute mesenteric adenitis, pelvic inflammatory disease, ruptured Graafian follicle, twisted ovarian cyst, ruptured ectopic pregnancy, acute gastroenteritis, Meckel's diverticulitis, Crohn's enteritis, colonic annihilation. Appendicitis mimic other disease: any bowel obstruction, cholecystitis, diverticulitis, duodenal ulcer, epigastric, gastroenteritis, hernia, ileocolitis, inflammatory bowel disease, Crohn's disease, intussusception, Meckel's diverticulum, mesenteric adenitis, neoplasm, omental torsion, pancreatitis, perforated viscous volvulus, epididymoorchitis, nephrolithiasis, perinephric abscess, prostatitis, pyelonephritis, testicular torsion, urinary tract infection. For female, ectopic pregnancy, endometriosis, Mittel's bulge, ovarian cyst, ovarian torsion, ovarian tumor, pelvic inflammatory disease, tubo-ovarian abscess, and systemic disease: diabetic ketoacidosis, porphyria, sickle cell disease, henoxylin purpura, miscellaneous parasitic infection, pneumonia, sauce abscess, pulmonary infiltration, rectal sheath hematoma. This is the acute appendicitis. Appendicitis, they are inflamed, and after they increase the pressure, increase the neutrophil due to E. coli, Bacteroides fragilis, or decrease the immune system. Histology, they are more neutrophil cell in the appendix. So clinical assessment through clinical diagnosis, ultrasonogram, CT scan, and after we decide is gangrenous appendicitis or appendicular abscess. If on conservative, no improvement, need operative surgery. The ultrasonogram confirmed the appendicitis. This is a ultrasonogram confirmation appendicitis, and CT scan visualize enlarged appendix more than 7 millimeter in diameter, and ultrasonogram more than 6 millimeter in diameter of the appendix is positive. Is the CT scan. CT scan this is the position where appendix present. After antibiotic treatment, if it is not operated, recurrence rate 40% within 5 years. So laparoscopic surgery now increasing the appendixectomy done by laparoscopic surgery, and open appendicectomy, open the surgery. Prognosis mortality 1%, and complication perforation, wound abscess, wound infection, wound dehiscence, internal abscess, fecal fistula, intestinal obstruction, adhesive band, inguinal hernia, and preventing appendicitis by some studies show high fiber diet is good to prevent the appendicitis. Thank you for listening.